Hello and welcome to my channel. I am Dr. Amal Banu. Today, we're diving into a crucial yet often overlooked topic in healthcare, drug-induced diseases or DIDs. Modern medicine is a marvel, a testament to human ingenuity and scientific progress. We have drugs that can cure infections, manage chronic conditions, and alleviate symptoms that once caused immense suffering. We can even replace failing organs, giving people a second chance at life. It's easy to think of medications as miracle cures, the ultimate solution to our health problems. But there's a flip side, a hidden complexity that we must acknowledge. Just as a sword can protect and harm, medications can heal and hurt, often in ways we don't immediately see. These unintended consequences are called drug-induced diseases, or DIDs, and they are more common than we might think. They are a growing concern in the medical community as more cases come to light. DIDs occur when a medication triggers a new health problem, one that wasn't present before. This isn't about allergic reactions or side effects, which are usually immediate and expected. DIDs are often delayed, making them harder to trace back to the medication. They can develop gradually and mimic other conditions, leading to misdiagnosis and mistreatment. This makes them difficult to diagnose, as the true cause of the symptoms can be elusive. Think of it like this: you take a medication to fix a leaky faucet, expecting it to solve the problem. But unbeknownst to you, it's slowly corroding the pipes, leading to a much bigger problem down the line, one that you never anticipated. That's the challenge with DIDs. They are the hidden dangers lurking behind the promise of relief. We need to be aware of the potential risks, understanding that every medication has the potential to cause harm. We need to use medications wisely, balancing the benefits with the risks, and always considering the long-term effects. And we need to be vigilant in monitoring for any adverse effects, ready to act if something goes wrong. Only then can we truly harness the power of modern medicine without falling victim to its double-edged nature. Let's take a trip to India. Here, a concerning practice called stent gun therapy is prevalent. Doctors prescribe a cocktail of antibiotics for common illnesses. This is regardless of whether they are actually needed. It's like using a stent gun to kill a fly. Overkill, right? Why does this happen? One reason is the misconception that more drugs equal faster results. Patients often pressure doctors for a quick fix. Doctors, in turn, might feel compelled to prescribe multiple medications. This is to appease their patients and avoid losing them to another doctor who might comply. However, this approach is like playing Russian roulette with your health. Every unnecessary drug you take increases the risk of DIDs. It also contributes to a much bigger global threat, antibiotic resistance. We live in a world of instant gratification. We want everything fast and easy, including our healthcare. Patients often walk into a doctor's office expecting a quick fix, a magic pill. This puts immense pressure on doctors. They are caught between meeting patient expectations and practicing evidence-based medicine. Imagine a mechanic trying to fix a complex engine problem. The customer is breathing down their neck, demanding a quick fix. The mechanic knows the engine needs time and careful diagnosis, but the pressure to deliver is immense. This is the reality for many healthcare professionals. The pressure to prescribe, especially in a culture that expects a pill for every ill, can lead to over-medication and increase the risk of DIDs. ADRs, the unseen epidemic. Adverse drug reactions, or ADRs, are a major public health concern that often goes unnoticed. They are the fourth leading cause of death in the United States, a staggering statistic that many are unaware of. That's more than car accidents, AIDS, and diabetes combined. It's a silent killer that demands our attention. ADRs encompass a wide range of harmful effects, impacting countless lives every day. These range from mild side effects like nausea or dizziness to life-threatening conditions like liver failure or severe allergic reactions. Think of it like this: you take an over-the-counter pain reliever for a headache, something many of us do without a second thought. You get relief, but you also experience heartburn or an upset stomach. That's a mild ADR, a small price to pay for relief. Now imagine taking a prescription drug for a serious condition, something that is supposed to help you manage or cure a significant health issue. The drug works, but it also damages your kidneys, or causes other severe side effects. That's a serious ADR and potentially life-threatening, altering the course of your life dramatically. The problem with ADRs is that they often go unreported and unrecognized, slipping through the cracks of our healthcare system. Many people don't connect their symptoms to their medications, attributing them to other causes or simply ignoring them. And even when they do, it can be challenging to prove the link, making it difficult to address and prevent future occurrences. This unseen epidemic requires more awareness and better reporting to protect public health. The rise of the superbugs, a prescription for disaster. This is a story of how our greatest medical advancements are now turning against us. Remember the stent gun therapy we talked about earlier? It was once a revolutionary approach, but now it's part of the problem. Overusing and misusing antibiotics is like training bacteria to dodge bullets. Each misuse is a lesson for them to become stronger. Every time we expose bacteria to antibiotics, we give the resistant ones a chance to survive and multiply. It's a survival of the fittest scenario. Over time, this leads to the emergence of superbugs, bacteria that are resistant to multiple antibiotics. These superbugs are a growing menace in our hospitals and communities. Imagine a field of dandelions. Each one represents a different strain of bacteria. You spray it with weed killer, but a few dandelions have a mutation that makes them resistant. These resilient dandelions are like the bacteria that survive antibiotic treatment. These resistant dandelions survive and spread their seeds, creating a new generation of superweeds. Similarly, resistant bacteria spread and multiply, becoming more prevalent. That's what's happening with antibiotic resistance. It's a cycle of survival and adaptation. We're creating a world where common infections could once again become deadly. Simple cuts and minor surgeries could pose serious risks. This is a major threat to global health, and it's directly linked to the overuse and misuse of medications. We must act now to change our practices and preserve the effectiveness of antibiotics for future generations. Thank you for watching. If you found this video informative, please like, share, and subscribe for more health-related content. Stay safe and informed.